trauma, 15 minutes is hand trauma.
Ortho, surgery. That's it.
You've got to
We're just going to get on, do this.
not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output, you know?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you.
Well, listen.
Right, who's not busy? Squeeze that.
We can't give up, I know. Come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
Good morning, A&E. Michael speaking. Hello. No, this is accident emergency. Okay.
It's getting silly now, man. Come on. I need to go and have a beer or withdrawal stuff.
The t-shirt.
That wasn't bad. That was a tiny one.
I was just wondering, could I get something to stop me from withdrawing from alcohol?
But you're not actually withdrawing them?
No, I've got the shakes, but...
Because I think they've seen you. The doctor doesn't think you need any of those. Medically, you're fine.
Yeah.
Until you show symptoms, they won't give you anything.
Okay, I'll just go back that way.
It's gonna be one of those days.
Any resource King's College Hospital. That's lovely. Thank you. Bye. Fitting.
Fitting after head injury. So do you think it's a fit and then fall over and hit the head? Have we got lorazepam, sister, or have we got diazepam? IV access, if that's possible. Just normal saline in case it's a drinker.
Hello, King's A&E Resus. Okay, go ahead.
Can you say so?
1, 2, 3.
Stroke red phone, 8 minutes. Stroke red phone, 8 minutes.
If you imagine your brain's entrapped in this shell, from a head injury point of view, if you bang your head, it's been shaken quite vigorously. So you're going to be confused, disorientated, and then you've opened your eyes, you don't know any of your surroundings.
Hello, Elaine. I'm Dr. Hobbs. I'm one of the accident and emergency consultants. Hello. And can you remember what happened? Okay. Now listen, we're going to have to pop a little line in your arm and take some blood.
Imagine how scary and frightening that must be.
Today.
You right there, John? Can you hear me okay? Yeah. Do you know where you are yet? No. Do you know who I am? No. You're in the hospital now, John.
You need to put some. I've fallen down the stairs at a tube station and woke up to a doctor who I knew shaking my leg saying, you know who I am, you know who I am. And I said, I don't know who you are. I don't know where I am. Where am I?
1, 2, 3.
And I was petrified. There wasn't a friend in sight. There wasn't a face I knew. I'd never been so scared in my life. I was petrified.
En route, he was quite absent en route, and since the police has no idea where he is, who he is, what he's doing, anything.
Okay. Can you tell me your name?
Good old shakes.
John.
Come back.
John.
Once he came back, yeah,
Do you know where you are right now?
no.
You're in King's College Hospital. So I know and imagine what these people are going through in their heads.
He has got complete right side of it. He's got no sensation down his right arm. He's got sensation in his right leg, but no sensation in his left arm.
Do you know why you've come here today? No. No, okay. You went to St Thomas's Hospital. You showed signs of a right-sided weakness. So they're querying whether you may have had like a little stroke or something. Okay? Now we're a specialist centre for that, so that's why they've sent you here, so we can get a scan of your head. And if it does show that you've had a stroke, then we have a sort of clot-busting drug to clear that blockage, yeah, and try and get you back to normal again. Are you allergic to anything?
Just work.
Work. I think I might agree with you on that one.
How quickly can things change with the person with the head injury?
Within a click of a finger. You could be asking them their name, and then they could be fitting, next minute they're unconscious, next minute they could be dead. So very, very, very quickly.
Hello, King's Amy. 12 minutes. Okay, thanks so much. Thanks, bye.
Adults from call 12 minutes.
Who have we got?
I think we have an orthopod. I think we have a surgeon.
All we know is that is a pedestrian hit by a motorbike, so we need to make a quick assessment. So does everybody know what they're doing?
Should we go in 7? Yeah. Is that all right? Katrina, we'll pop this next one in your room.
Okay, so I've called to the strike and 20 Teresa's by 7, call to the strike, 20 Teresa, thank you.
We're not going to have a good day, are we?
All we know is that is a pedestrian hit by a motorbike, so...
Oh, they're here.
Yeah.
Forty-seven-year-old Chrissy was crossing a road 500 metres from her home when she was knocked down by a motorcyclist.
Okay, this is Chrissy, she's a 47-year-old female, hit approximately an hour and 15 minutes ago, left-hand side impact with motorcycle RTC. Queering loss of consciousness, she doesn't remember the incident at all. She's got impact on the left-hand side of the face, she's got ulcer swelling to the left-hand side.
We'll wrap you all up in a minute, okay? We just need to get some clothes off, okay, lovely?
A is clear, trachea central.
Concussion is equal.
The left side of Chrissy's face took the force of the impact. The main concern is potential bleeding behind the eye or in the brain.
Okay.
I'm just going to try and lighten your eyes, okay?
Pupil 3mm post reacting, no regular medication.
Doing really well. Chrissy, got a concussion, my love, and a little bruise in your brain. Okay, we're going to scan your head. Do we need to ring anybody?
Depends how long I'm going to be here, maybe.
We've got some details of ringing anybody.
No. Do you have any details of...
I've only got the female's details. She's got a mobile phone, but it's obviously coded.
Coded.
So I can't get into that. We believe her husband to be Tim Fenner.
Is there any chance you can try and track down a number for him? Because her memory's a bit stuck at the moment.
Chrissy, is there any pain there? On your neck? Here? Here? A little bit there. So maybe a bit in T7.
Yeah, all right there. I'm at this RTA shooter's hill. I've got the casualty up at King's. I've got a name and a date of birth, and we're desperately trying to find the next of kin kind of contact number. I was coming back from the garage where I'd got the car. I'd taken the car in to have some work done that morning, and the traffic was just stacked up all the way down the hill, and I was like cursing and swearing because I couldn't get home.
So we make sure we take a vomit bowl.
Of course, I got stuck in the traffic jam that her accident had caused. First thing I knew was sort of coming in and the phone ringing. And I've got this guy from the Metropolitan Police telling me that, my wife's been involved in an accident and I need to get to King's College as soon as possible.
OK, my love, what we're going to do now is we're going to move you onto the CT scanner. You just lie there and the scanner does the scanning, OK? Sorry, sweetie.
It was 20-odd years ago. We started going out together.
Ready, brace, roll, slide.
We didn't work in the same office as such, but on the same floor. I'm pretty certain it was almost love at first sight. So, sounds a bit corny, doesn't it? But there was an instant attraction in that sort of warmth of her face and the glow that she seemed to give off. And within a matter of weeks, I'd sort of proposed to her and said, well, why don't we sort of make it a go of, a proper go of things and get married, so.
She's got a head injury. She's got a head injury. She's got quite a bad bruise around her eye. She's got a black eye here and a little laceration. I think I felt some gravel here, but we haven't really examined her scalp with the collar off, if you see what around the back of. But there's no huge big hematoma there. It's all here. I suspect she may have some facial fractures because she's vomited blood en route. But she's very, very sort of drowsy and amnesic at the GCS-14.
2 hours after the accident, there's the police there. There's still the tape up and everything. And this police constable was sort of more or less gesturing that I couldn't go through. And I'm like, well, I said, well, the accident's actually my wife that was involved in the accident, so I suppose I didn't really ask any questions because I didn't really want to know in a way. I was just focused on the idea of getting to the hospital.
I don't know whether I like even like taking that as a compliment. That everyone always says I look like your sister.
That means I look old.
No, it means I look young and I want to look like your mum.
That means I look old.
That wasn't me.
Lacey as well thought he was 19.
Who did?
Who? Lacey as well.
Her mum thought I was 19. See, that's embarrassing, Roxanne.
She showed her mum a picture back from my birthday and that, and then she was like, how old do you think that girl is? And then she was like, about 19.
Roxanne, that's embarrassing more than anything. Hello?
Yeah, John?
John? John? You all right there? Do you remember where you are? I was just speaking to you. My name's David. You're at King's College Hospital.
Okay.
Do you remember anything else I said to you?
No.
No. Okay.
Somebody sounds happy.
Are we ready to rock and roll? And now the under's near. I must see
my face, the final curtain.
Yeah, you got it, my friends. You got it. You got it. They did it my
way.
Bit of old Frank Sinatra, eh?
Oh, he can't beat him. Hello.
Do you think you'll be able to shuffle yourself over onto our bed? Would you want us to slide you?
Of course I can shuffle.
Lovely, great.
Lovely.
I could tango as well if you want.
Just the sliding for the moment, maybe the tango later.
Oh.
I know, spoil sport.
Stroke is a blockage to a vessel which stops oxygenating blood getting to various parts of the brain. If you have a blood clot on the left side of your brain, your right side of your arm and leg will stop working.
Whenever you're ready.
Okay.
I think.
No, the leg's not working.
Not working.
Okay,
Let's
we
slide.
can slide you
Let's
there.
slide you across. All right.
Why is it not working?
Well, we're not sure at the minute, so that's why we're going for the scan of your head. Okay. But let's slide you across. All right. It won't take too long. Don't worry, we'll slide you across, John. John. Oh, hold on.
Don't want you to. Lovely, well done. Keep coming over. That's lovely. And all you need to do for this is keep very, very still for me, okay?
Okay.
Do your eyes just while the lasers come on, just so they don't hurt your eyes. Okay. Nice and still there.
You did an operation for a cyst.
That would be it then.
Yeah.
The scan has revealed a previous operation to remove a cyst in John's brain. It explains some of his short-term memory loss.
There is some brain there.
Yeah.
But there's no blood.
So we just carry on and thrombolise.
While the doctors have found no significant bleed in the brain, John's history of right-sided weakness means they will still treat him for a minor stroke.
Joan, how are you doing? We believe you may have had a stroke, Joan, so we're going to give you some clot-busting medication.
Okay. So I'm not going to die yet.
Not at all. Don't talk like that.
I swear I blink about 1,000,000 times a minute when I'm tired.
You always blink. I feel sick.
Yeah, you feel sick probably because you need to eat. This is what I'm saying to you, Rox. You need to eat. You can't just have biscuits.
Had a cream egg as well.
I Roxanne, you need a sandwich or something, darling. Shall I quickly nip round then? We're better off going now. Go then? Yeah, we're going. Go on then. All right, wait a minute. Why are you thinking a minute?
Be rich.
Okay, I'm gonna go. Right, what do you want?
Okay, my love. The scan does show you've got a broken bones around your eye. Sure. That's okay, they get better. And you've got a little fracture in your skull, okay? So you've obviously, when you landed, just landed front here. These things will fix. That's why you feel terrible, why you're vomiting some blood. The scan shows that you haven't got anything wrong with your brain, so that's good. But you probably do have a bit of a concussion. So you're definitely going to be with us for today in hospital. This lady, the whole imaging's been done. Spiros here is her trauma fellows, just making the phone calls to Neuro and Max Fax as we speak.
Sorry, how this morning was supposed to work out, was it? Tim was on his way. You're not worried about anything?
Luke, 3999. Don't ask me old.
It's a significant accident, and like she does not. Your mother walking past would say she doesn't look right.
Yeah.
Do you know what I mean? It's not life-threatening. It may be life-changing. When people have severe head injuries, they can have epileptic fits. They can have character changes, particularly the frontal ones. The truth is, you're not necessarily back to normal again once you've had a serious head injury. You can affect blood flow to particularly the frontal cortex, where our personality comes from, and our personalities change. You can't help the way you've changed because the injury can't be undone. But unfortunately, that living has to go on.
John, do you know where you are?
No.
No. You're in King's College Hospital, okay? Do you know what month it is?
No.
No. It's March.
Oh.
Okay. And what year?
Springtime.
What year is it? It's 2012.
No.
No, it is 2012. Okay. Alright, Alright. Don't worry, okay? You're gonna have to shine light into your eyes as well. There's tissues over there. Got some tissues here. It's all right.
Yes.
It's gonna be all right.
Hello. Full cream or low cream?
What time do you have your dinner then?
I'll have it later.
What time do you have yours, Ivy?
Later.
About 6:30. What do you eat all day then?
I haven't eaten anything yet.
I haven't had anything, but I only usually have a sandwich anyway. You have no breakfast, friend?
No.
I only have a bit of toast in the morning.
Oh dear.
Picnic in A&E waiting room. This is a picnic, just a sandwich.
What did you do about your dinner?
Marion, she's talking to you.
Aren't you hungry?
A bit. Survive.
Are you hungry?
A bit peckish.
Why life?
Huh?
What's a life?
Oh, hello, eye clinic. Sorry to trouble you. Can I speak to the ophthalmology registrar on call, please? It's a lady who was crossing the road who was hit by a motorbike. In her left orbit, she's got a fracture of every single wall. So the lateral, the medial, the posterior, and the inferior. The only thing she hasn't fractured, we think of that, is the superior wall, okay?
I met Tim when I was 21. He was just very, very good looking. It was just wow. And we were engaged within 3 weeks. 3 weeks before the wedding, I turned around to him and said, sorry, don't want to marry you. To Tim, because I said those words, you know, I don't want to marry you, he just sort of switched off. For me, I thought he was just moving out to just think and get, you know, just get himself together, and that he was, you know, gonna come back, and then we'd ever talk about it, but he never did.
Hello, Mr. Fenner. I'm Dr. Hobbs. I'm one of the emergency medicine consultants. Your wife is able to speak to you in there, but she has had a head injury. I don't need you to do anything apart from sit there and hold her hand.
And then about 4 years ago, I wrote to him and I said, you know, would you want to get in touch, and so we could just sort of have some closure, because you just disappeared and there was no closure, and for me it just was left hanging for over 20 years.
She'll be better for seeing you.
Yeah.
There's this letter in front of me from a person that I'd really loved and felt such a great bond with, and yet, yeah, things went wrong at the time, but there were still those feelings there. I actually sat on that letter for about a month thinking about things, and I got to the point where I thought, well, what have I got to lose?
There is no bleed as such in her brain, right?
Where's the blood at the moment coming from?
And it's just like a bit of sort of tissue or swelling, blood swelling from all the soft tissues and the muscles that surround the eye, and it's in its socket.
We didn't plan anything, it just happened. It was like doors opened and you had the choice. You either go through the door or you don't go through the door, and it was just the universe paving the way for us. To us, it was like getting a second chance. It was like, you know, look, we messed up the first time. You know, we shouldn't have broken up. And it just felt like the universe was giving us a second chance.
And I suppose I felt an overwhelming sense of, you know, I'm home, I suppose, in a lot of ways.
No, seriously.
All right, it ain't gonna be long now.
What have we got to wait for now?
For him to arrange the scan.
A scan or an X-ray?
A scan.
That's where they put the jelly on, isn't it?
I think so,
Yeah,
yeah.
like a baby scan.
Yeah.
They put the jelly on to scan it. Jelly and custard.
Very funny. What time do I get me dinner?
We don't
It
get
won't
it
be
here.
long now.
Won't be long.
Hey?
We try and get you a cup of tea in a minute. We got to wait for them to do the X-ray of your
Just
foot.
waiting to go down for an X-ray.
I got to wait all the time for my dinner.
No, we'll get you something,
Mum,
Mum,
because...
because...
then you can have your dinner when you go home.
Yeah, but by the time she waits
We've got to wait till I go home for my dinner.
I think so, yeah, but we'll get you something to keep you going.
Do I get my dinner here?
No, you...
God, just tell her
We're
yes.
gonna-
Yes,
I'm
you
gonna-
do.
Yeah, in a
after.
minute, yeah.
They're cooking it now.
And I get my dinner?
Yeah, they're cooking it for you.
What would you... He's going to ask you what you'd like. What would you like for dinner? What would you like for dinner?
Roast dinner.
Requests.
Roast dinner.
A roast dinner. Right, no problem.
Oh, you got to go and buy it somewhere?
No, they're going to do it for us after that. You can't eat before the scan. You're not allowed to eat before the scan.
What am I doing here?
They're X-raying your leg to see why it's swollen.
"22-year-old Benedict is back at King's. He's been drinking.
At the time, before I realised I had a drinking problem, I felt on top of the world. I felt amazing. I thought, this is great. This is all I wanted to ever do is just, drink. At the peak of my alcoholism, my worst, I would say I was drinking basically anything as quick, as cheap as I can to be obliterated, to block out reality. I was just in my own little world. It was just me, the street, the off-licence, and the can of lager. That was me.
How much do you normally drink a day?
About 74 units.
About how many?
74 units.
74?
Yeah.
A day? In one day? Wow. And what in the cider, is it just cider?
Cider, yeah. No, I could easily have up to 9 litres of 3 litres of white ale.
Wow. 9% cider.
9%, yeah.
What made you start drinking in the first place?
I don't know, you can tell me.
Do you regret it?
Yeah, of course I do. You're very pretty.
Thank you. That's nice of you to say. Make me blush?
Really?
Nah. It takes a lot to make me blush, really.
I think I was about 6 years old, just starting out primary school, and we all got brought into the main hall. This guy stood up and he said, well, this is what we call the trumpet. And he must have played something really cool, like the Pink Panther, or something really cheesy theme tune. And I said, from that day onwards, I said, that's what I want to do. It's letting your emotions free. It's my voice. If I can't say something, I'll let you know via the trumpet. I'm just sick of the withdrawals and the fits. So,
And then you drink to stop you feeling like rubbish.
yeah, I don't enjoy it, I hate it.
It must be hard.
Yeah,
Hard work. Stop you feeling rough.
Yeah. There were some times if I left the house, I would have my trumpet case with me, but there wasn't a trumpet in there. There was a big bottle of cider. I couldn't stay sober enough to sit through one rehearsal. The drinking had really messed up something that I've always wanted to do.
thanks for it. Yeah, I had a chat with her earlier, so she's groggy, more groggy now. I wish her a speedy recovery. Okay. Yeah. Okay, no worries, Tim. Right. Thank you. Thanks. Bye.
It is a marathon, it's not a sprint. Long after the hospital has discharged them, the process of getting well may still be going on, and it's the relatives who carry the burden of that.
First floor of Jamie Wing.
Okay. All right, you go and we'll meet you there.
It will affect a relationship between a husband and wife, a relationship between the parents and the children, or even between the children. They will carry the weight of that burden for years to come, probably a lifetime.
Because I suffer from severe withdrawal from alcohol. The nurse said, I can't give you a fag. There we go, someone a lot worse off than I am. Yeah.
I had 3 children. Simon is very political, which I enjoyed. Emily went to my college and did English and drama, and I love English. And Benedict took up the music, and of course that was my first love and first profession.
I'll see you in a sec.
I'm very proud of Benedict. Taking the lead in Tchaikovsky 4 or Bruckner 4, I mean, at one end of the spectrum, or hearing him playing a trumpet concerto from memory. But when somebody that you've brought up and been proud of is an alcoholic, I think there aren't enough words really to describe the intense sorrow and pain that one can feel. It's a disease which just, it's like cancer or MS. It doesn't matter who you are, where you live, how rich you are, how powerful you are, whether you have one parent or no parents, whether you're in prison or whether you're a high court. It just grabs you, and I think there isn't. I don't think there is a stereotype. It can happen to anybody at any time.
No. What? I don't know, mate.
Yeah, where are you going?
I've got a bed.
You got a bed where?
I don't know.
Wait.
Yeah.
Come here. Yeah. Quick.
Yeah.
Where is it? Yeah.
Yeah.
Put it away. It's all right.
Yeah.
He's just getting back to his walking back slowly.
Yeah?
Yeah.
Walking back.
Is it
No, need a chair.
No.
You're gonna fall, mate.
Yeah.
I can't control it, and I can't cure it. It's the 3 C's. It's a sort of standard little mantra, isn't it? I can't control it. I didn't cause it, and I can't cure it. And again, that's the insidious part of the disease, is that only Benedict can cure it himself.
Yeah.
All right, cool. Thank you, bro.
Ben, what are you doing outside?
I fag.
To tell the nurse you went outside.
No.
You should have told the nurse.
Hello? There's no blood clot. Oh, and everything's all right. Oh, so where are you now? On your way back? All right, see you in a minute. Bye.
Show me the pictures you took in Great Yarmouth that you said you had on your phone.
No, on the camera.
Oh, was it?
Take Annie on the phone.
We're never going to see them then.
No, I didn't take Annie on the phone there.
So she's okay, there's no clot?
No clot.
Hi, Benedict. Hi, it's Emmanuel from Mental Health.
Yeah, I remember.
You remember me last night, isn't it? Okay. What's happening? What
I had
happened today?
a withdrawal fit. Normally I have a certain amount of drugs that I have to take, but they are not giving it to me, so...
If you need it, definitely they'll prescribe it for you.
No, but I do need it. One doctor said, yes,
you think you
can.
need it, but when they've done the assessment, they don't think you need it.
It makes you feel sick to the stomach that I actually became a compulsive drunk alcoholic liar. I was that guy. I was the guy. I was like, I'm not him again, you know. Here we go again. It's the same routine. I wanted the attention. I wanted the care.
How best will you describe your mood at the moment?
Out of 10, about 1.5.
And how long have you been feeling low for?
I'd say since I was about 19. I'm now 22. I cut my 2 sides of the neck, as you can see.
And why did you do that?
I tried to kill myself. I was going to go for here, but I didn't have the balls to do it, so... When I say the balls, I didn't have the guts to do it, because I was dead scared of what could happen if I did it. So.
There have been many times when I've said to myself and to others, something has to happen here. This cannot go on. Do I kick him out on the street? Do I spend thousands in a private rehab? I cannot handle this anymore.
Do you still feel like you want to hurt yourself?
No, not at the moment. No. I just want to have a beer. Because I know that's the one that's going to stop me from feeling the way I feel. You know what I mean?
Why haven't you kicked him out? Why do you think you haven't?
I love him too much.
Yeah, I'm good to go.
Well, I'm having a go and chat with the doctor, so you just take a seat. I wonder what's going on. I'm not going to see him on a park bench or drinking with the winos down the street corner. I'd rather have him here unconscious than allow that to happen. At least when he's here, I know that there'll be a solution.
Your bloods are all completely normal.
Really?
So your liver function's absolutely fine at the moment. Don't think for a minute that means if you keep drinking like this, it'll stay fine, because you won't.
Yeah.
Not at all, but at the moment it's fine.
Okay. So, thank you very much for your time.
Okay.
All right,
Thank you. Bye-bye.
He doesn't need to apologise. He doesn't need to explain. Because when he's not drinking, he's my son again, and we just move on. I forgive him. Full stop. He doesn't even have to say sorry.
Missing you already. Bye.
I'm not very good at being romantic or anything else. I suppose that's the one good thing that's come out of the accident, is the fact that it's woken me up, and hopefully I think she sees that I actually try harder now. Couldn't imagine life without her, really.
I went through a detox program straight from King's. I was there for 3 days. It wasn't easy, obviously, because I was the youngest there by about 30 years. But I did it.
Every night I lie awake and I'm scared. Dad was powerless over my addiction and my actions. You know, the one thing he said to me was, I'll always have a roof and a plate of food. But I didn't realise how grateful that I should have been at the time, you know, to have a roof, a bed and a full stomach every night and every day, you know. To this day, can't thank him enough.
Security control, good evening, hello.
There's a reason why we do checks, okay? There's a reason why we do checks. It's a hospital.
8-year-old fallen 3 metres.
Do you want to go round? Head injury in children always makes me worried. They want, please tell me this is going to all be all right. And I can't, because I will not give false hope. Thank you.